Hafide, welcome back. In this segment, we have, of course, representatives from public health here with me. Maybe you can introduce yourselves.
Hi, my name is Alyssa Unkenko. I'm with the Department of Public Health and Social Services, and I am the program coordinator, which I oversee the behavioral risk factor surveillance system.
Perfect. And of course, Pat.
Half a day. I'm Patrick Lucis. I'm the acting health services administrator at this time for the Bureau of Community Health Services, in addition to my hat as the program coordinator for the Diabetes Prevention and Control Program at the Department of Public Health and Social Services.
Nice. Welcome.
Thank you.
And of course, today we are talking about a very special survey that is ongoing at your office. Can you tell me more about that?
Okay, well, we have, again, we call the Behavioral Risk Factor Surveillance System Program, or we call it as the acronym BRFSS, or BRFS, and it is a 100% federally funded program through CDC. It is a survey conducted worldwide. It's one of the largest health risk behavior survey, and those who are participating in the survey are all 50 states, the District of Columbia, some of the territories like Virgin Islands, American Samoa, Puerto Rico, and our neighboring islands, Palau, FSM, and Guam.
Wow. Honored to be a part of it. And so tell me a little bit more about the survey. I know they do ask very specific health questions, and it is completely random, if I'm not mistaken, right? So someone gives you a call, you answer, and you know it's a legit survey, right?
Yes.
And tell us more about what the questions look like.
Okay, well, the BRFS survey, we ask questions at a state level, questions related to health risk behavior, like tobacco use, alcohol consumption, physical activity. Then we have other chronic disease questions on diabetes, cardiovascular disease, hypertension, overweight, and obesity, which is our BMI. We collect height and weight measurement. And then we have questions on preventive health practices, on cancer screening, and many more other topics.
Right, really cool. And so what happens with that data? I mean, why is that survey so important?
Okay, well, the importance of BRFS data is to assess the health needs and status of our island population, and also to identify any health disparities so that we can improve the health of our community. And BRFS data can be utilized in many different ways by many people within our community. For example, it serves as a public health tool to track health trends and to compare health behaviors across the nation. And then we have health program staff that utilize the data to monitor the effectiveness of their implemented programs, and as well as to monitor and evaluate and measure the progress on whether they are actually making an impact in the community. Then we have public health officials and other organizations who use the data to justify their need when writing their grants. And we have college students from the University of Guam and other off-island colleges who request for data
Right.
to use it for as part of their capstone project and research paper. We have policymakers that can take advantage and use the data when to guide them and drive the development of health-related policies.
That's really awesome. So lots of different uses for
Yeah.
that data. And so if someone gets a call, I mean, would you encourage them to take the survey? Of course, right?
Yes.
Yeah, in this day and age, there's so many, different kind of calls that are out there. But, we want to assure our community that when they get a call from the Department of Public Health and Social Services Behavior Risk Factor Surveillance Survey, it is a legit survey. We do have a contract with our contractor who's actually based out of Hawaii. They do the surveys for Hawaii and some of the other states as well. But it is a legit survey. And, just like in any survey, if you feel uncomfortable whether it's a legit survey or not, feel free to call us at the Department of Health at 735-7289. Or, one of the other tips that you could do is ask the surveyor for their contact number, and then you can call them back and make sure that it is a legit survey. You can, feel free to ask who's our supervisor and any other questions. And so our contractors are aware of these kind of questions, and so they're always ready to respond in any way.
Nice. And I know, Pat, you were saying you are also doing a physical survey. Is that correct?
Yes, that's correct. So in addition to just the phone survey, we're taking it a step further. Our survey with the BFSS, it is a phone survey, so we're able to compare data for Guam and the rest of the 50 states. What's different with comparing with our neighboring islands around the Pacific, within the 22 countries, they do more of a physical survey. So that is actually doing measurement test for example, BMI, using a tape measure, measuring the height. So one thing that we're doing for the BFSS is called the BFSS Plus, and we're asking those who participate in the survey if they would like to participate in this BFSS Plus. When they agree to that, we have a little incentive for them to participate, and they'll get their measurements, and so that gives us an additional set of measurements that we're able to compare with some of the other Pacific Islands. The Pacific Islands, they have a different survey, and they do actual measurements, going face to face to the household, doing those kind of measures. So it gives us an opportunity to measure with our neighboring islands as well.
Nice. This sounds like a great survey opportunity that will really benefit the community, like you said, help implement new policies, and really get that data. I think is valuable. So while we're finishing up here, any last minute thoughts you'd like to tell us? It is an ongoing survey that will continue throughout the year.
Yes, the survey has been initiated since 1997. It's an ongoing survey throughout the year on a calendar year from January through December. If you do get a call, please, we encourage everyone to participate for a better and healthier community.
Nice, perfect. Well, thank you so much for joining me, Public Health.
Can I also add as well that if you want to get an idea of what kind of data we have out there, you can visit the cdc.gov /BFSS, and you'll be able to see some of our prevalence rates, for example, for diabetes, for obesity, physical activity, and then again, you can always see some of that data from our department website, dphss.guam.gov, or you can see our Live Healthy Guam Facebook page, and you'll be able to find some data in there as well.
Nice. All different places. We could just type it up online and we'll be there. But don't forget, if you get a call from Public Health, it is a legit survey and you should fill it out.